Well, hello everyone, I'm Dr. Brown, neurologist. I specialize in the rehab of brain disorders and correcting brain disorders as well as brain performance. Now, last time we were talking about the balance between right and left brain. We were talking about function. How does it work? Where does it go wrong? In this picture that we have up today, this really does describe right-left frontal lobe function. When you look at the left frontal lobe here, look at what the picture looks like. This is brilliantly done. You can see how it's so logical, it's linear, it's structural. You see how everything is straight lines, it's geometrical. It screams science. It screams logic. That's what the left frontal lobe is all about, is that logic. It's about linear thinking, solving equations. It's very necessary. That's where language is. That's where picking the right word that you want to say comes from. That's where we can write and we can read. It's all on that side of the brain. Now you notice that there's a lot of space there. See all that space? Which means then it's very focused, the left side of the brain. It has the ability to focus on tiny details. That's why there's so much space there. Now you look at the contrasting side on the right. Well, first of all, you don't see a lot of space, do you? And you see a lot of colors that represent aggression, drama, pain. There's a lot of emotion. There's romance in there. If you look closely, you'll see romance, and there's a lipstick on the mouth. You see the bull right there with the red eyes, very aggressive. And then you look at the alcohol glass. I guess that would be the no, it's not champagne. I don't even know what it is. I don't drink. Anyway, so at the bottom there again, we're talking about passion. That's the side where we know romance. We know we can fall in love because of our right frontal lobes. Without it, we can't fall in love. The left frontal lobe cannot truly fall in love if it's on its own. The right frontal lobe is what convinces it that this is a good idea. Without the right frontal lobe, it's a bad idea. It's not logical. All right, so notice the difference. Notice the big difference. So these two are very important. We can see that, can't we? Without our right frontal lobe activity, we can't love. We can't feel what someone else feels. We can't sympathize, and we surely cannot empathize with someone else. This is human nature. Without it, we are not human. Which brings me back to the subject we were talking about before, and that's autism. It's so sad because a person with autism, they're such brilliant minds, but they're all right here. You see all that empty space? They're not fulfilled, they're not full, they're not complete, because all of this emotion is not there. But there's ways of bringing it back. There's ways of activating this right frontal lobe so that they can become whole, so they can become a person who cares, a person who loves, someone human, that we consider human. Now, how do we do that? Well, we talked last time a little bit about hacking. How do you hack a person's brain? Well, the right side of the brain controls the left side of the body. And the left side of the brain controls the right side of the body. Well, all the sensory input, which means touch, movement, anything coming from the right side of my body is going to stimulate my left side of my brain, and the other way too. So then if I actually touch my foot on one side, I have just stimulated the other side of my brain. That's a basic premise, and based on that simple basic premise, we can actually hack a person's brain. Depending on what part of that brain needs to be stimulated, we can stimulate it by using those mechanisms. Most simply put, that's how it's done. Well, hello everyone. I'm Dr. Brown, neurologist. I specialize in the rehab of brain disorders and correcting brain disorders, as well as brain performance. Now, last time we were talking about the balance between right and left brain. We were talking about function. How does it work? Where does it go wrong? And this picture that we have up today, this really does describe right, left frontal lobe function. When you look at the left frontal lobe here, look at what the picture looks like. This is brilliantly done. You can see how it's so logical, it's linear, it's structural. You see how everything is straight lines, it's geometrical. It screams science. It screams logic. That's what the left frontal lobe is all about, is that logic. It's about linear thinking, solving equations. It's very necessary. That's where language is. That's where picking the right word that you want to say comes from. That's where we can write and we can read. It's all on that side of the brain. And then you notice that there's a lot of space there. See all that space? Which means then it's very focused, the left side of the brain. It has the ability to focus on tiny details. That's why there's so much space there. Now you look at the contrasting side on the right. Well, first of all, you don't see a lot of space, do you? And you see a lot of colors that represent aggression, drama, pain. There's a lot of emotion. There's romance in there. If you look closely, you'll see romance, and there's a lipstick on the mouth. You see the bull right there with the red eyes, very aggressive. And then you look at the alcohol glass. I guess that would be the no, it's not champagne. I don't even know what it is. I don't drink. Anyway, so at the bottom there again, we're talking about passion. That's the side where we know romance. We know we can fall in love because of our right frontal lobes. Without it, we can't fall in love. The left frontal lobe cannot truly fall in love if it's on its own. The right frontal lobe is what convinces it that this is a good idea. Without the right frontal lobe, it's a bad idea. It's not logical. All right, so notice the difference. Notice the big difference. So these two are very important. We can see that, can't we? Without our right frontal lobe activity, we can't love. We can't feel what someone else feels. We can't sympathize, and we surely cannot empathize with someone else. This is human nature. Without it, we are not human. Which brings me back to the subject we were talking about before, and that's autism. It's so sad because a person with autism, they're such brilliant minds, but they're all right here. You see all that empty space? They're not fulfilled, they're not full, they're not complete, because all of this emotion is not there. But there's ways of bringing it back. There's ways of activating this right frontal lobe so that they can become whole, so they can become a person who cares, a person who loves, someone human, that we consider human. Now, how do we do that? Well, we talked last time a little bit about hacking. How do you hack a person's brain? Well, the right side of the brain controls the left side of the body. And the left side of the brain controls the right side of the body. Well, all the sensory input, which means touch, movement, anything coming from the right side of my body is going to stimulate my left side of my brain, and the other way too. So then if I actually touch my foot on one side, I have just stimulated the other side of my brain. That's a basic premise. And based on that simple, basic premise, we can actually hack a person's brain. Depending on what part of that brain needs to be stimulated, we can stimulate it by using those mechanisms. Most simply put, that's how it's done. But obviously it's not that simple. It's much more complicated than that. But we have a program. In this program, first of all, we do a full exam to determine what is specifically, I don't like where this is going. I'm going too deep. No,
you need to get to your another slide now. We have a program. Pick it up there.
I went too fast into the program part. That was too fast.
No, it seemed like it was normal. Didn't you think so? Yeah, I mean, you're talking about hacking the brain. You're talking about
Like how?
we have a program. How does it work? What does it do? I think it's about 5 slides down. That's it, right?
Mm-hmm.
Okay. So we have.
Which one? That one?
No, that's a questionnaire we hand out.
That one?
That one looks interesting.
That's actually the description of the other picture. Everything there is its big picture, muscle control. That's important. That's good.
All right, I'll just go through this one real quick. Is that all right?
Okay. Where can we pick it up? I'll find a spot. Just say.
Just start going into it.
Yeah. Just say. What about this war in our head? What is going on here on the left and the right?
Okay. We were talking about right and left, and that there's a constant conflict between the right and the left. As I said before, in order for the right frontal lobe to do what it does, the left frontal lobe has to be quiet enough for it to happen, and vice versa. We see this a lot in marriages. In order for the wife to speak, the husband's got to be quiet, and vice versa. And you get conflict when that doesn't happen. Now, on this picture here, the war in your head, notice the differences between the left and the right. Left side, remember we talked about detail, small, it's able to see great detail, small picture. Whereas the right side, big picture. You get a person with the left frontal lobe dominant, he's looking at the tree, and the right frontal lobe dominant is looking at the forest. That's the difference, big difference. Verbal communication on the left, right side, they can read the nonverbal communication. A person who's very, very right frontal lobe dominant, super sensitive people, they can read you like a book because they can see what you're feeling by watching your movement and watching your face. It's a really right frontal lobe dominant person. And you can see there the small muscle control and large muscle control. There again, detail, big picture. Detail, big picture. Intelligent quotient, emotional quotient. Word reading, remember we talked about that word reading. Right side is comprehension, getting the moral of the story, understanding what it means. What does it mean for your life? How to extrapolate from there. Left frontal lobe can't do it and right side can. Left frontal lobe, interesting, is positive most of the time. Right frontal lobe, negative. A lot of the time, it's negative. You see this with artists a lot. They're self-destructive people. They're negative. They have a tendency to look at things with a glass half empty, if you will. Everything is an emotional tag on it, so therefore it can get very negative. They tend to be self-abusive then. They can be drug abusers even. So, looking at the left side again, receiving auditory input and interpreting it. Again, what we're seeing is the left brain does one thing and the right brain does another. If you get any point out of that, that's what you need to get. That the difference is between sides of the brain. Very different. All right, so when you came in here today, I gave you this questionnaire. And you all looked at this questionnaire, and I hope that you circled what applies to you in this questionnaire. Now what we're going to do now, don't write on them anymore, and nobody look at each other's paper. Don't look at the paper next to you. Just look at your own and think about yourself, and we're going to look at these individually. And I want you to think about, when we look at these individually, what frontal lobe does this? Which side is it that has this problem? Let's look at the first one. I talk without thinking. What could that be? Which frontal lobe would do that? The left frontal lobe would do that, because the right frontal lobe is what tells the left frontal lobe, don't do that, because it's inappropriate social behavior. You see? I worry about making mistakes. Now, who in the world could that be? Not the left, it's the right. I can't remember names. That's a gift, isn't it? That's easy. What is it? Left. If you can't remember names, right? I can't get stories straight. I mess up stories all the time. Who is that? You can't get them straight. That's linear thinking. That's our left frontal lobe failing us. And when I say left frontal lobe, I don't really mean to be so specific, but there's a lot more to it than that. I mix up letters. Left. I get the sounds of words wrong. The sounds of them. What do you think that could be? Is that left or is it right? Sounds of the letters. It's left, yeah. I worry a lot. Right. I have trouble reading clocks. Left. I have trouble with grammar. Left. I can't spell. Left. I can't remember faces. Right. I fear nothing. The right fears things. Left does not fear anything. That means that person is a left frontal lobe dominant person. I get lost easily. Right. Now here's why. Mapping, and that was good, mapping is a parietal lobe function. That's a different part. We haven't talked about that yet. But the right parietal lobe is aware of both sides of space, so it's really good at maps. I know that doesn't sound right, since it's not logical to be that way, but that's how that works. Mapping is a different part, different function in the brain. People say I have no sense of humor. Nobody wants to commit. It can be right, and believe it or not, it can actually be left because of what we say. If we can't control it. I hurt people's feelings without knowing it. Yes, that's the right frontal lobe not engaging, because we don't know it. If our right frontal lobe engages, we know we just hurt their feelings, and we're going to immediately apologize, right? Remember, with a person whose right frontal lobe is failing, they can't read your face. They don't know if you're upset or hurt. People say I have no manners. That's a left frontal lobe dominant person. People say I have no conscience. Again, same thing. I'm impulsive and do things I later regret. That is right. If it was just impulsive and didn't regret it, what would that be? Left, yeah. I can't learn how to play a musical instrument. I put that in there. It's more complicated than that. It depends on what. Is it the action, or is it the feeling, or is it the inability to read the notes? I put that in there on purpose because it can be either side, depending on what it is. That's why it's so complicated to treat people and their brain disorders. We have to be specific to know what function we're trying to correct. Music is a great example of that. That's why the full neurological exam is so important. We'll talk about that in a minute. It says, I can't understand math symbols like the letter X. Who could that be? Yeah, that's left. That's left. I can't read a map? Right. I have bad habits. Yes, why? Because the right frontal lobe says, man, that's a bad habit. You are embarrassing yourself and people around you. That's what the right frontal lobe is supposed to do. But if it fails, we don't know it. I describe left frontal lobe people as they're the happiest people on earth, but people around them can be falling apart and they don't know it. They're like the Mr. Magoos of the world, driving around, people crashing around them, they don't even know it. Happiest people on earth. I can't remember music. Again, that depends on what about the music we can't remember. Thing about music, music with lyrics, any kind of music with lyrics, if you can understand the lyrics, is stimulating your right frontal lobe. That's what it's doing. Music without lyrics is stimulating your left frontal lobe for the most part. Left frontal lobe likes complicated music with no lyrics. Right frontal lobe likes those lyrics. Its favorite is the emotional music. That's why country music is so emotional, because it's all about the lyrics and the story. And I won't get into that. I can't sing harmonies. In order to sing harmonies, we have to know what those notes are. We have to be able to hear the harmonies, right? So that's both sides at once. And we're talking about temporal lobe. It is both sides at once. First of all, to pick the note is left. To know where the note's supposed to go is right. So that's complicated. That's why it's so hard to do. I can't do phonics or sound out words. Which side you say?
I think it's when someone has a problem with their left.
Phonics, yeah, left. Because it's the beginning of the whole word anyway. It's the alphabet. That's what left side does, the left. Now, I keep saying sides. Each part of the brain has its own function, but it shares a lot of it with other parts of the brain. That's what makes it so complicated, and that's what makes it so important to pay attention to the details. All right, so welcome back, everybody. We were talking last time about right and left functionality. We were talking about right and left frontal lobe, what they do, how they're different. I thought now we'll talk about the individual lobes of the brain. Now, again, we're not getting into the minute details. We're talking about general structures. These structures oppose one another all the time. So let's look at the structures first, and then I'll get into that more in a minute. First of all, looking at the picture, we talked about the frontal lobe. We talked a little bit about the parietal lobe, and we're looking at the right side here. And then the temporal lobe we mentioned, and there's the occipital lobe in the back. Now these are general big areas. Down at the bottom, that's the cerebellum. Most people know about that because it is what controls balance. It interprets information coming from our eyes, and it interprets information coming from our ears, and the sensory information coming from our bodies to tell us where we are in space. Now, to give you some understanding about what all that means, have you ever been dizzy? Of course, we've all been dizzy. What happens when you get dizzy is your ears are telling your brain that you're somewhere, and your eyes are telling your brain that you're somewhere else. When that happens, you get dizzy because there's a conflict of information coming into your brain. So that tells you then how important it is that there is a good switchboard, a good interpreter of all this information coming in. from the body and from outside of our environment. Remember, there's information that comes out here, comes into our brain from outside of the body. Light, sound, anything comes from out here. It stimulates the opposite brain. Anything. All right, so frontal lobe, we talked a lot about that already. Parietal lobe. Now the parietal lobe, that's the lobe that interprets this information we were just talking about, sensory information. Like, where is my right foot right now? You're thinking about your right foot. You know where your right foot is, right? I hope so. You know where your left foot is. You know where your body parts are, right? Where's your left index finger? Well, you know where it is. That's because of the parietal lobe is telling you where it is. And not only does it tell you where your parts are, but it also tells you where your neighbor's parts are. Like if I say, where is the person sitting next to you's right foot? Well, the parietal lobe is so good, not only can it tell you where your foot is, but it also knows where your neighbor's foot is. It interprets all of that. And it interprets how that foot that's on your neighbor's foot or leg, how does that foot relate to space around it? I know that one person's foot in here is underneath the chair. How do I know this? Because my parietal lobe has interpreted all of that information, space, where the foot is, what a foot is, and its relationship to that body and to me, and the space around me all at once. This is being interpreted by my parietal lobe. If I don't know where my parts are, I can't tell you where yours are. There are certain stroke victims, for example, who don't know about certain parts of their bodies because that part of the brain that relates to that part of the body has been destroyed. There's cases where we'll see people with neglect, one side or the other neglect because of this. They'll shave one side of their face and not the other. And then someone will point that out to them. Why didn't you shave your... What are you talking about? Of course I shaved it. Because they don't even know that that part exists. Parietal lobe. If it's damaged, we don't know where parts are and we don't know where other people's parts are. It can get complicated, as you can imagine. Now the temporal lobe. On the left side, the temporal lobe, that part of the brain interprets and picks out the words for us. Also, being it's right there beside the ear, you can imagine it's got something to do with hearing. Yes, of course it does. It has a lot to do with hearing. On the left side, it has a lot to do with also with mathematics and calculations, the temporal lobe. On the right side, it takes other functions up. Along with hearing, it also takes up some functions of understanding. So when I talked about understanding before, it doesn't just include the frontal lobes, but it also includes these temporal lobes here. Also on the left, in the temporal lobe, but up in here, that's the part that helps us to speak. We call it Broca's speech area, so we can articulate what we say. Some people can get this damage too in stroke, whereas they know what they want to say, but they can't say it. Babies, as they develop their speech, that part of the brain is what's developing so they can enunciate the words. The other parts of the brain, to pick the words out, well, they got to first know them, then they got to choose them. Certain areas of the brain are what does that, which is why the activation therapy works for people with speech pathology. We can activate those areas of their brain specifically so that they can speak clearer. You will see an interview of a couple where I've worked with their child who has speech pathology, and activating those pathways works. So then, looking at the occipital lobe, that's the back part of the brain. Most of the time in school we learn that the occipital lobe is for sight, and that's true, it is for sight. But that part of the brain can only see in black and white. Ironic, or I don't know if it's ironic, oddly enough, color vision is interpreted by our temporal lobes. You wouldn't think that, but it's so. And that's a recent discovery, actually, within the last few years. We discovered that color vision is interpreted by the temporal lobe. And occipital lobe is black and white. If a person can't see color, it's because of that. The temporal lobes are failing. Again, remember, light coming from the right side of space stimulates the left side, and it's interpreted by that side, and it's vice versa. Now, things that can go wrong. Let's say a person has trouble reading a map. Well, we know that that has to do with the parietal lobe. The right parietal lobe understands both sides of the body and is aware of both sides of the body, whereas the left parietal lobe is unaware of the right side, of the left side rather, of the body. It knows of the right side, but it does not know that there is a left side, whereas the right parietal lobe knows there's both sides, there's two sides. Now, these things were discovered because of damage to the brain, be it stroke or trauma. But what we have to do then is integrate this whole system together in order to make it work. One of my favorite parts, if you look at the screen, is this part right here. Right there. You see that where the parietal, frontal, and temporal lobe comes together? That's a very interesting part on the left side of the brain only. That little triangle right there, if you stimulate that part on a human, they will experience a spiritual feeling. You know, like some people say, well, I get the Holy Spirit. You've heard people say that? They will experience that feeling. It's a spiritual euphoria. And it's only on the left side, and it's exactly right there at the junction of those 3 points. And I say, it was put there by God so that we would seek Him. Evolutionists, I don't know. I don't know how you explain that. But if you stimulate it, they will have a religious experience when it's stimulated. Fascinating. Now that we've looked at these parts, we'll talk next about treating them. All right, so scientific knowledge of the neurotransmitters, scientific knowledge of the pathways continues to grow. We have new technologies that are functional MRI. We have new technologies. There's even new CT scans, and there's actually magnetoencephalography, which is a highly complex system of MRI that can actually map the brain pathways. So we can watch the brain work almost. We're getting closer and closer to seeing these pathways work. So we have to be very specific about how we treat the brain. You cannot do this on just an interview alone. That's why the neurological exam is so critical. And it can't be just simple neurological exam. It's got to be specific too. The neurologist has got to be willing to take the time. Not only take the time to learn what I'm talking about here, but to take the time with the patient to do a proper exam. Now, looking at this slide in front of us right here, when we look at the neurological exam, there's new exam procedures that I'm applying. Now, some of these exam procedures look like they're old. If you're a physician out there, a neurologist that is, you're going to look at some of these things, you might think, I've heard of that. Well, you may have heard of it, but it's not the same as it used to be, I promise you that. Not with all the new technologies. We've changed all of these things. We now know so much more, even more, we know 10 times more 5 years ago today than we knew then. So we look at this list of examination procedures. Look at the applied optokinetics. Optokinetics means eye movement. By looking at the eye movements in detail, we can determine how well the frontal lobes are working, how well the parietal lobes are working, and how well the cerebellum and the occipital lobes are working. Again, we have to look at that carefully. That's how we find out one aspect of the neurological exam. Of course, we do the general neurological exam where we test all aspects of your nervous system, everything. Then we get into the scotopic hypersensitivity. This was discovered by an optometrist many years ago. When she discovered it, what she thought it was, we now know it's different. But it's a much more important thing now today than we realized it was back then, and what she realized she had found. It's extremely important. We know that various wavelengths of light affect us in different ways. We'll look at that in the neurological exam. Now, the last one, a long-term vestibular, cerebellar, parietal, frontal, temporal pathway applications. All of those systems working together. How well are they working together? Is there roadblocks in between any of those? If they are, we have to discover them in the neurological exam and then correct them. That's what I do. That's the difference. That's what we do when we see a patient, when we do the exam. That's why it takes the time that it takes. And that's why we can't do it without the exam. We can't make a diagnosis and fix someone without it. All right, so we've talked about neuroscience and how there's growth in the knowledge of neuroscience. Now, what about treatments? When your child, let's say your child has autism or he's on the spectrum, what's the treatments for that child? Well, we can give the child stimulant drugs. We can give them antidepressants, maybe. We might even get elaborate and do amino acid profiles and nutritional therapy. We might do that. May do that anyway. But is that the only answer? It's just not that simple. It just isn't that simple. We have to determine, based on objective, clean, clear neurological examination, what pathways are working and which ones are not. And when we do that, that's when we're correcting the brain. That's when we're helping the person. We can give a stimulant medication. It's going to stimulate everything. It's not going to fix that one pathway we need to fix. It's not going to do it. We got to know what pathways are wrong and correct them. That's the only way we can fix anybody. Now, when we look at the new exam procedures that we talked about, they're details. Now, when we look at these details, applied optokinetics, scotopic hypersensitivity, and then the integration of all the pathways, looking at each individual pathway at a time, what treatments can we use then? Well, remember, you've got hands, you've got eyes, you have feet, you have a body. Remember when we talked about hacking the brain? By using these parts that you have? That's how we do it. We hack the brain with those various parts. Now, looking at the next slide, you'll see that what I'd call this is pathway activation therapy. And it's based again on what pathway we need to deal with specifically. You notice it says the use of specific applied neurostimulation or even inhibition based on current scientific data relating to that pathway. How can we affect that pathway and fix it? That's what I do. Simple as I can say it, that's what I do. It's simple to say, but it's complicated. It's not something you can do in just an interview. I can't sit here and talk to you. I can't just sit here and watch you walk and think I'm going to figure you out. I'm not. It takes minimum an hour, sometimes a lot longer than that, to determine exactly which pathways we have to correct. And as we correct pathways, we see others that we need to correct along the way. It just continues to show more as we clear them all up. Now you notice in that therapy procedures, it could include any or all or even more that aren't listed. You notice I said electromagnetic pulse beta or theta waves. That's a possible treatment. It could be light in various wavelengths. It could be sound, depending on the condition. Movements, eye movements, balance, vibration, you name it. Depending on what pathway is faulty, what pathway is weak, that'll determine what we use to strengthen that pathway. But the point is, not being general, but now we can be specific. This is a different world in neurology now. We can now actually be specific with these different pathway abnormalities. Child has autism. That's just a term. What the real problem is there's certain pathways in that child's brain that are not working. We need to find them and fix them. All right, so all these conditions that we've talked about, notice the list there in front of you. If you know somebody with learning disability, speech pathology, balance disorder, traumatic brain injury, stroke rehab, behavioral problems, how about ADD or ADHD, autism, and even focus or motivation. All of these conditions have responded to pathway activation therapy. So if you know someone, you have a friend, family member who you would like to get help, to see if we can do something for them, just give me a call. Thank you.